Hello, and welcome to your cranial nerve exam. I'm assuming that you have an appointment today? Yes. Let's see here. And your name is Jared? Yep. Okay, let's see here. Yes, you do have an appointment today for the full cranial nerve exam. Of course, that's going to be everything that's up here, your eyes, ears, mouth, everywhere that we can just make sure that's working. And just want to make sure I stress it enough to you that this is not a doctor's appointment. There's no need to have anything that is an urge, anything to worry about today. Simple tests. They're actually quite relaxing, but these are just some simple tests that we can get done today to, just to get out the way and make sure that everything is working in the correct order, right? Yeah. So we're going to be doing a couple of tests today. Not going to be hard. Some of them will not hurt. Most of them will not hurt. There are only going to be one where it's going to be the sharpness dove test. That's the only time we will ever use a little sharp thing, but I wouldn't be concerned about that at all. So just take a deep breath and relax, okay? So you're going to set a place here. So it can be same home address. Yes. Same phone number. Yep. And everything else is staying the same, insurance, money, whatever. Yeah. Alright, good. Alright, so without further ado, why don't we get started here? So before we get cracking, I always like to put some gloves on here because things do get to be a bit invasive, and I don't want you to feel any bit uncomfortable at all, because we do get a bit close and personal, and things may get a little bit weird if we don't put on gloves, right? And we don't want that. We want everybody to feel comfortable and, just the usual. Now, these are medical grade gloves, so do not fret. These are very nice. These are not just any old gloves. These are not even the blue gloves. These are something better. Alright, so why don't we get started here? So, first thing I want you to do is I want you to put your hands out like this, and I'm just going to push right on the back of your hand, and I want you to resist me as I push, and keep your hand up instead of folding it down. So hand out, push, resist, good job. We'll do the other one, push, resist, good job. Now we're just going to do the opposite. Stop me from pulling your fingers back, just keep them straight, and don't let me push. So resist, good job. Resist, good job. Okay, so now I have a little cotton swab here, and I'm just going to test something real quick. Oh, there it is. It's in my pocket up here. We have a little cotton swab here, and I just want to test your nerves here. So I'm just going to rub it across the palm of your hand, and I want you to just look at me the whole time, okay? So here we go. I'm just going to... Good. Look at me. Look at me. Good. Look at me. Good. Okay, so now I'm going to tap instead of rubbing. This is going to be a little different. Just keep looking at me though. Good. Okay, good. So you passed that. Very good. So now what I want you to do, I want you to clench your jaw like this. Can you keep it tight there? And I'm just going to make some noises on the side, and I want you to tell me which ear you hear the noises in. So I'm just going to take it here, and you're just going to tell me which ear you hear it in. Good. Yeah, so that one was both, so I'm sure that one confused you a little bit, but you passed that with flying colors. So now what I'm going to do is I'm going to make some tapping noises here, and I want you to follow it with your eyes first, okay? So just follow the sound with your eyes. Good. Keep following it. Good. So now what I want you to do is I want you to close your eyes. Right, close them, and then I want you to follow the noise with your head. Okay, ready? Good. Keep following. Good. 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 Yeah. So you passed that with flying colors as well. So now we're just going to get into some of the basic hearing stuff and eye stuff here. So I want you to just relax for a minute. What I want you to do is I'm going to put my fingers here, and we're going to do one noise in the other hand and one noise in the other. So you tell me which ear you hear the noise in. Ready? Good. 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 Yeah. Alright, you passed the earring test with flying colors. Now we will inspect your ears later, just to see if there's any wax buildups, but you seem to be hearing with flying colors, and I don't think that'll be any concern at all. But now we're just going to take a look at your eyes real quick. So I have my light here, but first, before we do this light, before we do the light here, or actually, yeah, I'm actually going to check inside your eye first. So just open wide, real wide, keep them open. Good. I'm just going to check around the perimeter of your eye, making sure everything is in order. Yep, good, good, good. Yep, keep it still, keep it still. Yep, everything looks good in there. Now I'm just going to check your other eye here. Good, good. Everything, no dilution, whatever, no dilation, my bad. Nothing of any of the ordinary. Everything looks good in here. Yep, good. That's everything I want to see. So now I'm just going to take my finger, and you're just going to follow it with your eye, right? I want you to follow this with your eye. Good. 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 Keep following. Keep following. Keep going. Yep. Good job. Good job. Keep following. Keep following. Good job. Just keep following it. Keep following it. Good. 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 Keep following it. And now we're just going to do the same thing, but with the torch this time. So just keep following the torch here. And I'm actually going to distract you. I'm going to put my finger here. Follow the torch. Do not follow the light, okay? Follow the torch, not the light. Apologize, that's Tracy in the back. She's pretty loud. I'm sorry about that. She's one of our fellow colleagues, so just follow this light here, and don't focus on this finger. Good, yep, keep just focusing on that light. Just ignore what this finger does entirely. Now I'm just going to come in here. I want you to just keep focusing on the light. Keep focusing on the light. No, keep focusing on the light. Keep focusing on the light. Good. Keep focusing on that light. Keep focusing on the light. Good, good, good. Good, good, good. Yep, that's good. That's great. That's really good. Now I'm going to come in, and I just want you to resist here. I'm going to try to shut your eyes. I want you to keep them open. Keep them open. Good, 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 good. Keep them open. Keep them open. Good, good, good. So now I'm going to do the same thing. Close your eyes. Close your eyes. I'm going to try to shut them. I'm going to try to open them. My bad. Yep. Keep them close. Good, good, good. Keep them close. Keep them good. Yep. So you passed that with flying colors. Great job. Now I'm just going to do another basic sound test again. So I want you to keep still for a second, and I'm just going to take some notes here. Alright, that's pretty good. Yep, notes are looking good. So now what I'm going to do is I'm going to take a look in your ears real quick, just making sure there's no wax buildup, and then we'll probably have some more things to do. So let's take a look in here. Okay, looking pretty good in here. I'm actually going to come up real close, okay? Just stay right there, right? Ready? Come close. Okay, what do we got in here? It's looking pretty good in here. Yep, not seeing anything. Check the other side real quick for you. Okay, it's looking pretty good in here. Nothing out of the ordinary. Looks good, yep. Okay, that looks good to me. Earwax, a little build up, but we can get that sorted out. Just go check to your doctor. We'll give you paper for that. Now we're going to do a test here where you're going to tell me which side you hear the sound on, but this time you're going to close your eyes. Alright, so just close them, right? And then I want you to tell me which side you hear the noise on. Good. 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 And if you hear it on both, say both. Good. 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 Okay. Good, good, good. So now we're going to do a little test called the sharp and dull test. Okay, so I don't know. I think I put my Q-tip back in here. I'm just going to put my Q-tip again. Let me find it. And then we're going to do the sharp and dull test, which is quite easy. I'm going to have one sharp side of this, which is going to be just, that's a good question, the sharp thing. How about I use my finger? We're just going to pretend my finger is the sharp object here, and we're just going to do a little poke with my finger, and then you'll know which one the soft object is. So you tell me, okay, ready? So you tell me soft or dull. Soft. Soft. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Good. Good. Get it. Yep. You passed that really well. Okay, so now what I want you to do is I want you to puff up real wide, like take a deep breath and like really puff up and do a weird facial expression. I'm trying to push the air out of you, so push, 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 push. Good, 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 good. And now I want you to raise your eyebrows and I'm gonna try to push them down, okay? Good, good, keep them down, keep them up, yes, good, 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 good. You're resisting, good. And now I want you to smile like you've just won the lottery, you've won everything. So I'm gonna try to push that smile down. Good, 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 good. Yeah, good. Now I'm gonna do the same thing, but you're gonna frown, and I'm gonna try to push that up. So frown for me, real big frown, and I'm trying to push that up. Good, 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 good. Yep. Keep resisting there. And now I'm going to do. Now we're gonna quickly do a ear test again. I think. Wait, no. We've done the ear test, right? We did all the ear tests. So let me just mark all that down. The test we just did. Yep, that seems pretty good. And now I think we're going to do the smell test. And then we will almost be done, I think. Right? Yeah. So you pretty much passed this cranial nerve exam. I'm just going to take a quick peek in your mouth cavity. Just to make sure we don't have any swelling or anything of the sort. So just open wide for me and say, ah. Say it down wide. Yep. Yep, everything looks pretty good in here. Everything's spick and span. Not much reddening. That looks good. Nothing of the ordinary here. Everything looks good. Or should I say nothing out of the blue. Everything is in the ordinary. Nothing out of the blue here. Which is good. Which is really good. Good, good, good. Which is good. So put a light here for a minute. Oopsies. Okay, so now I just want to do a quick test here. We're going to do a quick smell test, right? And then we will quickly do that smell test here. Yep. So I have a couple of essential oils here, and I just want you to tell me which smell you smell, okay? So this is going to be some random smells. Could be anything that could ever exist. So you want me to tell you what that is? Hold on. Let me just quickly grab it on. Okay, I got the other one. So let's just do this quick test here. Alright, so now I just want you to shut your eyes, okay? Shut them. And now I just want you to. Or you don't have to shut them, my bad. Okay, smell this. What does it smell like? Lavender. Good. Got that right. Yes, that is indeed a hint of lavender, or lily, of course. Lavender and lily are kind of the same thing, but you get the idea. It smells like a lily. Good. You got that right. And then we're going to do quick could do a quick normal one. I want you to tell me what this one is, and you should have passed. Okay, ready? So just smell. Smell that? Yep. What does it smell like? Alcohol. You got that right? Yep. Alcohol pad. Great job. That is absolutely looking good. So let me just take some of your notes down here. Alright, so results here. You definitely passed the cranial nerve exam today. I just want you to do a couple more face expressions for me. Have a straight face and just lines. And I will try to move that. Yep, keep that straight. Yep, good job. Yep, everything looks really good on you today. Yep. I'm gonna come down here with my knee and I'm just going to hit it a little bit, and I want you to see if it will come up, which is normal. So just let me go bang. Yep, good. It came up like that. Perfect for me. And I'm gonna do the other one, and boom. Good, it came up. Yep, so that's really good. Is there anything else you want to ask me before I quickly go check if there's any more tests we need to do? Nope. Okay, so I might be back, and I'll let you know if there's any more tests we need to do along the way. So just sit here, relax, and I'll be right back. Okay, sir, I'm back. I just checked with my colleague Fred here. Everything looks good. Okay, everything looks really good. There's nothing in concern. Only thing I didn't do was just do a quick check of your heartbeat. I just forgot to do that. We don't really do that here, but we haven't done it in a while, so I just want to get a quick check on your heartbeat here. So just take a deep breath in and just let it all out. Alright, now we're just do that over here now. So just take a deep breath in and let it all out. And then we're just going to do it again. Take a deep breath and exhale. And one more deep breath. And a deep breath out. Yep. Alright, that looks really good. Yeah. So, we'll be booking your next cranial nerve exam for the next 1 year in advance. Alright, 1 year today. Looking good, man. Just want to say, on behalf of me and everybody here at the Cranial Nerve Exam Center, I want to thank you for coming in today. It's a really relaxing procedure, and we just want to make sure everything is in tip-top shape, okay? So, thank you for coming in, and I'll see you again next time, right? Yeah. I'll see you again next time, man. I'll see you later. Have a good night.